Awesome, Nacho. So many great pearls shared by Rich there. We're going to shift gears. We're going from a seasoned age dentist who's been a dentist since 1984 to a baby age dentist. And before you even say anything, what year were you born? For Jordan, yeah. What year were you born?
1994. I was born.
All right, so now
Holy
for Rich.
moly!
Yes.
You know, I was about to leave to give Jordan the spotlight, and I'm sorry I didn't leave earlier.
yeah, right. So now we're going from a sad to a bad. This is all part of Spicy Toppings. So as Rich says bye to us, I'm going to bring on Jordan, who's been an amazing positive force. Dr. Jordan Barnett, who's a baby age dentist. So Jordan, just orient ourselves with your story. Orient our story. When did you graduate from dental school, and where did you graduate from?
I graduated in the most fun year to graduate dental school in 2020,
Right,
June 14, from UOP, and
you were just thinking. I mean, everyone should just really embrace this. But also, I have to say, and while I am a very JBN and positive guy, it's becoming the 2021 grads have their own challenges this year, which you're going to talk about. But we've all graduated dental school. 2002 for me. I could not imagine doing it during a pandemic. So if you know someone who graduated during a pandemic, extra JBN for them. And then what have you done since you've graduated?
Sure. So since I've graduated, I work at 2 different private practices, and I recently picked up another day working at a nonprofit that basically is a van that has built out dental operatories, and we go do dentistry on kids who couldn't afford it. So
that's
yeah,
awesome.
just loving it.
So we're going to dig into this. Your story is the star. So if you're watching a baby age dentist, you know, you get out of dental school, you feel like crying on the inside or outside. How can you make it? So I want you to share what you brought with you here, your PowerPoint,
Definitely,
because this is going to be awesome. So the goal here is, so we got someone, Rich Maddow, been in dentistry for decades, sharing with us the same things that Jordan's going to share with us about being successful from a different angle. The pathway, this is awesome. The pathway to a bad dentist and how they can provide value. So I'm going to let you take over here, Jordan. I'll jump in with a few questions, but please share this with our audience.
Yeah, awesome. And, you know, and Paul, I just want to take the time to say thank you to you, all of Dental Nachos. Natalie, thanks for all that you do, and the whole team. You know, I've just been learning so much from Dental Nachos, and honestly, I've been having a plate full of nachos every day. So yeah, it's been great. So yeah, I appreciate the opportunity, and I'd love to share a little bit. So I just want to talk about how, especially now, right? How as a dental student do you maximize dental school, and kind of give you tips and ways that you know, I was able to, I think, get the most out of my dental school education, especially during COVID and all the fun stuff. And then how to get an associate position. I feel like maybe your school touches on that, but really, let's be honest, is it enough? I don't know. Maybe it is, maybe it isn't. Let's talk a little bit more. And then I think just how to be a good associate, because I think there's a lot of things that maybe new graduates miss, and just a little bit of logic, I guess, that we can dive into. So I graduated Fresno State, super happy Bulldog, UOP this last year. And then there are the 3 places that I work. Here, I'm actually at Dr. Darren Vogel's office right now. I got a couple patients that I'm seeing later today. Christopher Shumlian, amazing guy, just like Dr. Vogel. And then Healthy Smiles is the place I was talking about. So yeah, looking to get married this year to someone who is amazing. That's my family up there.
I just, they say, but getting married, Jordan, it's like, you know, love and sickness and health, all that stuff, right?
Yeah.
But this is what they should say up there. Do you want to be legally obligated to hang out with this person for the rest of your life? Because that's what it is. Marriage is a legal obligation to hang out. Think about it. You want to stop it, you got to get a judge involved. I think that should be the vows. So if you want to write your own vows.
Yeah, right. I can tell you that I am the person I am today because of her, and I can't wait to spend the rest of my life.
That's awesome.
So, yeah.
So happy for you.
Thank you. Yeah. So really what I'm talking about is maximizing dental school from a clinical standpoint. Because let's be honest, right? If you're like me, you know, you want to go do dentistry, general dentistry, whatever it is, right? I want to get the most out of my clinical education, right? And so for me, we'll talk a little bit more. You see the PowerPoint for each patient, right? When you have a patient, let's say you're at dental school, pretend if you are a dental student that you are a faculty and it's your responsibility to help you as a student, right? How prepared you are really does go a long way in terms of their measure of your competence, right? So here I said, take photos of everything. You'll kind of see how I did it, what I did. And of course, every school has different rules. Please, I'm not asking you to break the rules of your school, but work with your school. You're paying the school to be there, right? Hopefully they'll be able to work with you. If they're not, well, then that's another bridge that we can cross later. And then lastly, what I did is, hey, I want to be a general dentist. General dentist market to people, right? We're looking for new patients. I really appreciated what Dr. Maddow said earlier. He knows more about the stuff than I do. But yeah, when I was in dental school, I walked around. Starbucks is right around the corner. And yeah, I had 25 different people that came and saw me because I had business cards at my school that my school gave me. And I said, hey, you guys have great insurance. We're literally right next door. Why not? And
I love that, Jordan. That's so valuable. And I talk about ABB, always be branding. And for some crazy reason, dental school makes you feel bad that you charge people money. Yet dental school charges you hundreds of thousands of dollars. But here's the thing. Obviously, I'm standing behind this Nacho brand. So when I leave here, I just become a normal dad walking around. But you know how many people see this and say, oh, what's that dental nachos thing? So I actually believe this is a good idea. You should contact our sponsor, A-Best, make yourself your own swag for your own self, right? Yeah. Whether it costs you guys $500, $1,000 for you, and it should say stuff like, I'm one of the nicest dentists you ever meet. Ask me about dentistry. You could say, I became a dentist. I know that's kind of weird because I'm telling you, what you're doing is awesome there. And if you could wear some of your branding just as a dentist, and it doesn't have to be every day, but what I'm sharing is you will see the magic. So I just think what you did there is awesome.
Well, thanks. Yeah. And like, that was the one thing that they told us at my school. They said, hey, if you bring a patient in, you get to do whatever procedure. So I did 2 root canals my second year, which was like a unheard of thing. Holy crap. How do you do that? Because these were patients that I brought in, right? That I met, my barber was one of them, and another person was another one. So yeah, definitely. That was a huge thing to help me. So I talked about making a PowerPoint for each presentation. So I kind of gave a little, example that I did. So this was a patient that I saw in school. So here, what you see when the teacher came over to me for a start check, what they saw is something like this. They saw, this is the case overview. Let's be honest, they make you fill out these crazy medical histories and Axiom with 86 questions, right? Do you really need to know all those things? No, we want to know what are the things that actually affect their dental treatment. Right. Show them these things, right? Most of your faculty at dental school have worked at a private practice. They're not looking at all these things. Show them what they want to see. Show them their chief concerns and why you're doing the things that you're doing, right? And then give them the relevant x-rays. Don't show them this huge blob of x-rays that, what am I supposed to get out of that? Show them exactly what you're doing. And then if you want to go even a little bit further, show them the pictures of your progress. Because what happens after that, right, is you have all of this work that you can get and you can put it into a portfolio. Again, we're talking about maximizing dental school from a clinical standpoint, getting as many patients you can get. Let's be honest, if you're just sitting and waiting for the school to give you patients, right? Yeah, you may not have a patient that needs a crown your whole first year in clinic. That's crazy to me, Paul. That's crazy. You're paying to go to school, right? You want to get these clinical experiences. And I'm not saying that it's easy, right?
And I'll pause for a second because you're sharing such advice. So I'm one of the first people to kindly annoy dental schools into doing better and kindly share the reality of what's happening. But if you're playing a 3rd or 4th year game right now, I am also a big fan of this, and maybe this will help you in your practice today or tomorrow. So everything that matters needs a system, and everything matters. With the customized, make the best decision in the moment. So if you're in dental school right now, the best decision in the moment might be to do exactly what you're doing, Jordan. Find people from outside the dental school who might need care. So I love that message.
Well, and I mean, the question I had for myself was like, okay, does everyone need a dentist? Everyone in the world? The answer should be yes. If they have teeth or not, yes, they need someone to be evaluating their teeth. Okay, great. That means that everyone could be a patient, right? I lived in San Francisco in downtown. They have all these people that are not seeing a dentist at all. I love what I do. And hey, you know what? You should come to the school, right? There's a lot of benefits that I'd love to talk about with dental students if they're really curious how to do this. And I said 25 patients that I brought in. I gave out about 1,000 business cards. So it's not like I had 100% success rate. You know what I mean? So just FYI, hey, I get what it's like to be in school. I understand. I was down like everyone else too. It's difficult, but hey, you either make excuses or you just kind of figure it out. And I'm happy to help anyone out figuring it out. So again, I talked about taking pictures of everything. You're already setting up all these PowerPoints. What they really should be for is for you, if you're someone like me who wanted to go straight to private practice or work, right? It should be about making a portfolio. Dr. Nacho, he's a private practice owner, right? And if I'm walking in as a new graduate from 2020, 2021, let's be honest, Paul's probably like, well, do you even have any experience, right? How do you know what I did? Everyone's dental school experience is different, right? Whether it's COVID or not. And so some people might have had a lot of opportunities, other people might not have. And you have no idea who the dentist is that you're talking to what their experience was. So a portfolio with actual pictures, something that you can discuss that you've done, you can actually show that competence, one, two, what you did, why you recommended it. And again, here I have that presentable format that you'd basically talk about the work. And this is something that really, really allowed me to show the owner dentist that I was looking and interviewing with. It's like, hey, this is where my skill level is currently. Yeah. Right. And so what I have here is I have just a little screen recording. This is my personal portfolio. Here I have a link. Paul, if you guys want, we can share this.
For sure. Natalie,
anyone who's interested in doing it.
Facebook Live. This is outstanding.
Yeah, thanks. And here you can see, right? So I have the CV right that way. It's updated and active. People can always view that whenever they want.
And you've done something that we're going to do a Job Connect TV show, Jordan. I just want to share for a minute. I talk about making a BTL video, bring to life video. And this screen recording is an awesome example of that. Make something that's 60 seconds to 2 minutes about you that you could share. I mean, you've gone above and beyond with your website here, but it's so great because dentists love details about everything, right? What kind of ice cream do you get? Is it from a farm? Is it not from a farm? Is it from a farm that I know?
Right.
So just give them the details about you, because this is a big decision to what's challenging, Jordan, and I understand this is, but you're seeing this. Would you hire you? Maybe, maybe not. It's a big decision. So give them what they need. So this is fantastic. Really, really awesome.
Well, thank you, Paul. And to that point, right, this is what and this seems kind of crazy to say in an interview, right? But I told all of the people that I interviewed with, it's like, look, like I'm right here in Darren Bogle's office. Darren Bogle's been working here for 25 years. He's been my dentist since I was 2 years old. My family comes to see him, right? And I told him, look, you've never had an associate here before. And let's be honest, this is the biggest risk you've ever taken, taking me on, right? And that's just calling it what it is, right? And so, I understand that from my side. And if you are a beginning age dentist, if you think you're good at anything clinically, well, I only work with people that I think do great work, right? And so I'm constantly learning, and I'm telling them that, hey, you know what? Let's look at x-rays. Let's take pictures of things, right? We're in 2021. I'll take pictures of everything you want. I'll take post-op bite wings of every filling I do. You want to see those? Fine. Let's talk about them. Let's talk about how I can get better and how I can provide value to your practice and your patients. So lastly, I kind of want to talk about finding a job, because I know I've heard it from a bunch of my classmates, right? A bunch of people, a bunch of beginning age dentists, like, oh, I can't get a job. 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 It's like, well, how are we finding jobs, right? And understand, anyone that's watching this, the only reason that I formulated or found these things out is I had my own business for 5 years, right? I had to be thinking about these things because I had to pay to get into school, right? And so it's like, I had to think about these things, and these are just school of hard knocks coming out. So yeah, first figure out where you want to live. Again, my future wife's here. She bought a house a couple of years ago, actually a mile from my parents, amen, which is only 2 miles from my practice. I'll get into that a little bit later. Awesome, right? And then secondly, you're a new dentist, right? We need to think about, if you want to be in private practice, think about the business of dentistry, right? There's specialists that help you if you're a general dentist, right? And there's laboratories that you're going to be sending out to do work. So for me, it's like I'm creating business relationships with specialists and with dental laboratories. I'm a beginning age dentist, Paul. I'm not going to be doing second molar endos, right? Let's just be honest. Now, my bosses might, and again, I'd be happy to talk to them about that, right? But you know what? I would love to know the periodontists around here. I would love to know the oral surgeons around here. I would love to know the endodontists. And guess what? They want to know you too, because they're seeing someone who's new, right? And I want them to take a vested interest in me. And not only that, what about dental laboratories, right? What about dental laboratories? Guess what? They're the ones who are actually seeing the cases. They're seeing the work, right? Believe me, now that I'm in private practice, right? The labs, we really do a whole bunch, to make their lives either easier or harder.
The labs, I'll stop you for 1 second, because there's a good book called Never Eat Alone. And one of my favorite stories is Paul Revere. I'm in Philly. I love history. It's also my name.
Yeah.
So people thought that Paul Revere just got on his horse and told people that the British were coming, which is not true at all. Paul Revere was one of the biggest connectors of that time. So there apparently was another guy who also tried to tell people the British were coming. And let's just, to make the story easy, Paul Revere was able to tell 50 times as many people as the other guy because of his relationships. And the labs have relationships with dentists, and the lab will a dentist will say, why are you sending me so many crowns? A lab will say, why am I getting so many crowns from you? And the dentist will say, my associate left because she went to perio. And the only person who knows that is the lab person. And if you know the
Right.
lab person, they say, oh, there's this young dentist who's moving into this area. Why don't you talk to them? So that Paul Revere world, and your advice there is just so spot on.
Well, and think about this, Paul, right? Like, you're creating a relationship and you're saying like, hey, you know what? You're a nice person, right? You, the endodontists, are nice and you're giving me the time. You're letting me shadow you and let me introduce myself. Like, hey, if you're great, you know, as a person, right? I'm just assuming in private practice, you're probably going to be of decent quality. Of course, I'll find out if we are referred to you and something goes sideways, right? But it's like, well, hang on. If you're a private practice owner or you work in private practice and you're a specialist, you're probably going to be pretty decent, right? And it's like, and you have now a vested interest in my success, right? That's what we need to figure out, new graduates, is like, have people that have a vested interest in you. If a laboratory is willing to allow me to look, shadow and watch them, and for, you know, I didn't get that experience in dental school. Great. And they're showing me, I can see the work that they're doing. It's like, okay, good. You're good quality. I've watched you and you actually care about me getting a job. Amen. Right. And then from there, you're going to ask in those relationships, like, hey, who are people, do you know anyone that's maybe looking for an associate, or who's someone who has high volume, especially with COVID? The entire dental world has shifted, right? Some dentists some dental offices that weren't doing great. Some of them are, you know, haven't survived. Right. And because of that, some dentists that were always good, now they're just getting this huge influx of patients. This is a really interesting time in dentistry. Right. So great. They're going to know some names. And then once you find some names, right, you can call these people. And that's what I did, is I just called the front office and say, hey, you know, I'm Jordan Barnett. I'm a new dentist. And I heard, you know, from the laboratory and the endodontist that you referred to that you guys are great. I would love to come meet the doctor and come shadow if that's okay. No one's going to say no to that. Right. Especially if you do it the right way. And then from there, that's why you have your portfolio ready, right? And again, I have the steps listed out right there. So I kind of want to talk about how kind of I went about this whole thing.
Yeah,
so
I'd love to hear
here, right? This is a map of Fresno Clovis, right? Here, that red triangle, that's right where Susie and I live. Okay, so great. So from there, like I said, I looked and I said, okay, who are 2 laboratories? I called all the laboratories in Fresno. Here's 2 laboratories that I really liked. Both of them are awesome. One of them does more removable type stuff, which I really do enjoy. Removable, it kicks my butt, but I love it. I just delivered an amazing case, Paul. This is totally a dental nachos. Shout out to UOP. Shout out to dental nachos. Like,
thanks.
20 extractions at once, and then we just delivered full upper, full lower, and she's like in tears, and I was crying too. It was just amazing. That's right. So I guess who did the lab work? Is the lab? Yeah, go ahead, Paul.
No, I was just saying that's what you're doing an awesome job with this presentation and sharing so much value, but I don't want you to gloss over that story because it's such an important one. You took out all these teeth on a human being.
Yeah.
You gave her new teeth that she can smile with. How well she can chew, TBD, smile. She feels better. You feel better. That's the AATI, always about the impact that matters. But to be able to create an impact, I know this sounds funny. I make it sound funny, but it's not money. You can't create the most beautiful emergence profile in the world if you don't have a job. You can't do this if you don't have a job. So whether you think what Jordan's sharing is not so fun or boring or annoying, well, to get to the thing you want to do, have that impact, you need to do this. Secondly, you can sell with 2 things, Jordan: positivity and pain, right? Doesn't matter what it is. You go to a gym, you're going to look good on the beach. You're going to be able to play with your kids. You're going to get different clothes, positivity. If you don't go to this gym, you may have to take cholesterol medication. You may not have flexibility. You may not be alive later. Positivity, pain. So if you're selling your thing, which is great, which is just sharing, hey, I get to take out teeth and enjoy all this stuff, that's positive. Here's the pain. If you don't find a job, you might not be able to ever pay off your loans. If you don't find a job, you might be living in your parents' basement. No disrespect to your parents' basement, but these are the 2 works. So I just want to stop and take that great story and use it as an example of how people can motivate themselves to move forward. So I'll let you go back, but really appreciate that.
Definitely. And I'll just add to that. Thank you, Paul. Absolutely. And just know that anyone who's watching, especially students, or I don't care where you are, bad, mad, or sad, right? Or GAD, golden age, right? It's like, I think what you do is so cool. Like, I can't believe I pinch myself every morning I get to do this, right? It's just so awesome. And it's like, yeah, look, and we'll talk about JBN later, right? But it's like, the fact that it's like, I just want everyone to know that like, I just want you to feel good. I know what dental school is like, even if your dental school rocks, which UOP rocked, I'm really happy with it. I mean, it's school, it's hard, you know what I mean? But it's like, I want all dentists to be happy. And it's like, we're not going to be happy if we don't have a job. You're going to be the most overeducated basement dweller ever, right? Or two, right? You're going to have a job that you're not happy with because you're going to have philosophies that don't make sense. And so we'll talk about it in a little bit. But so yeah, like I said, so I found the 2 laboratories, right? This one, actually, I don't know if you can see my mouse, the one in the middle of the screen, that's actually the one that did those, that case, the upper lower denture, right? Perfect. They got in contact with me. And then here's the 3 specialists. Here's the endo, here's my OS, and here's my perio. Awesome guys. I've shadowed all of them. Actually, my endodontist is the only female endodontist, and she is awesome. Let's just put it this way. She's not new, but she's a bad dentist.
That's awesome.
I think you know what I mean there. She's amazing, like that. Right? And then here, these are the 2 places that I work. I heard a lot, right? No competes, right? All these types of things. Again, I don't work for people who are worried about their dentistry not holding up. I work for people who do good dentistry, right? Who have patients that are coming in because guess what? They treat people right because they do good work. And so, we can talk about non-competes. We can talk about all that crazy stuff. Like that was never an issue. And I can tell you that I told them at the same time, like, look, I know I'm a new dentist, but at the very least, I'm objective. And, I'm going to be looking at your work because all the patients that I see will be your work. And if I start to see you do things that I disagree with, like I'm out of here because I won't stay at a place that isn't doing things that align with my philosophies, whatever those are. So just to give everyone an idea, right? Like it doesn't have to be this crazy complex formula. Just talk to people who will have a vested interest in your success. And guess what? Your patients will notice that and they love it too. And it just makes you look even better. So lastly, I think the most important thing to talk about is money, right? Because I think, and I want to be real, especially to the, dental students or new age dentists, right? It's like, you have to say things, or when you're talking to future employers potentially, right, that are congruent with each other. If you say that I don't want to be a business owner and I don't want to have the headache of the administrative stuff, and also I only do X procedure, I won't do anything else, but I need to be paid like I'm the owner, that does not make any sense. And what you sound like, I'm sorry, you sound silly. Yeah. Right. It makes no sense. And of course, people are going to laugh you out of the room.
And I want to say, right? George, you're also just going to sound super, and I'll use it, unaware of how the real world works. Right. So when the dentist says, new dentist says, I only get to do fillings and pediatric dentistry and exams and night guards. What I tell them is do the best job possible on those 5 things, and then you'll move up. Additionally, I teach implant placement, and I've used this example many times. In Philadelphia, Natalie's watching with us. We have 76, one of the toughest roads to drive on in the country. We have little side streets and we have a parking lot. You want to start to learn how to drive in a parking lot and then move up to the side streets. If you start in the too hard of road, you may give up on the procedure. Someone may get hurt. Someone may be disinterested. So sometimes the boundaries good practice owners may put on you may be to corral your passion for doing stuff. So I totally agree with you that you want to seem like you're aware of how the private practice dentistry works. So I'll let you keep going, but awesome point.
Definitely, and to that point, right? Like, I'm a new graduate, it's cool. I'm a dentist now, right? My first job was $8 an hour picking watermelons in the field, right? So it's like, however much you want to pay me is going to be a lot more than that. And I'm a dentist, so I shouldn't be on a bread line anytime soon. Let's be honest, right? Even if you're paid what you think is too low. Right. And I think, like you said, in the real world, right? Like I work at both practices that are PPO, right? So, our crown fees here in Fresno Clovis are like $651 on Delta, which I can get into that later. I'm not a fan of that, obviously. But at the same time, right, if you want to demand your compensation to be X amount, I need to make this much. It's like, well, you better be able to produce that much too, right? Like that's what's insane to me is like, well, if you think you're just gonna be doing hygiene exams all day and then a new patient here or there and bring no one in, right? Well, then like if I'm the owner dentist, like, well, can't I do that myself? Right. So I think your compensation needs to match your production abilities. And of course, that's a nice thing, right? Keep metrics, keep data. I'll be happy to share, what I've been doing with my owners to talk about that. And again, last thing is too, it's like whoever you're working with, I think, especially if you're new like myself, you should be working with someone who you think does good dentistry, obviously, does it in the way that you believe, but also you should always be looking to learn from that person. And you should be acceptive and receptive to their feedback. You should be desiring their feedback. I told anyone that I've entered a professional working relationship with, I said, look, what I do not need is I do not need someone to smile at me and wipe my head and say, you're amazing at dentistry. No, I need someone who can be tough on feedback, because these are patients' lives, right? Yeah. This is the, like, get over yourself if just because you're doctor now.
It's also just about your own, what I call doing your own stress level and your own sanity. So sometimes I've taught at a GPR for years, so I exercise this muscle of giving feedback, but it's not an easy muscle to give. And a lot of people say they want feedback, but what they mean is, I just want nice feedback. But feedback comes in all shapes and sizes. So it should be done with a foundation of respect. It always should be done. I'll give you a quick tip, SBI from Mark Dorio, situation, behavior, impact. Hey, Jordan, remember that situation where you were working on a class 2 for 2 hours, right? The impact was the entire schedule got thrown off. Next time in that situation, I would like you to come to me and say, hey, Dr. Paul, this is going sideways. What should we do, right? I'm not here to baby you, but I want you to know that impact was 5 dental assistants couldn't pick up their kids from daycare on time because you threw the schedule off. So situation, behavior, impact, it shouldn't be if anyone's giving you feedback, you're just a young, slow dentist. That's not good feedback either, but always be cautious to hear, are they putting you down or are they criticizing what you did? Because criticizing what you did is always totally fair game. Criticizing you as a human being should not be there. You're slow, you're this. It should be about this happened. So such good point there, Jordan.
You know, and to that point, right? Like, look, I'm a beginning age dentist, right? And I can tell you specifically a case, you know, that happened here, right? It was probably the hardest day of my professional working career so far. And I did 18 MO, 19 MOD, 20 DO. And, you know, patient came back a month later, right? And I didn't feel great about it. I mark all the ones that I'm like, oh, I don't know. I talked to my bosses about that. And sure enough, she came back and there was decay left on 18, right? And so my boss called me and he was like, hey, look, like, and he took an x-ray pre-op and then post-op. And he's like, look how much more that I did. It's like, wow, it was eye-opening to me. And we talked about it. And I told him, and this is the way that, especially if you're an associate coming into a practice, you need to look at, right? He's looking at it and I'm saying, like, I hope you know, I told him this and I believe this, right? It's like, I hope you know, like, you will never criticize me more than I will criticize myself, right? I am a new dentist, right? Like, this is a hard thing to do. This is so hard, Paul. I love it. It's challenging. I didn't do dentistry because
Jordan,
it's easy.
I could give you, I know anyone listening now or watching the future, the reason I think you might have gotten yourself into that Nacho jam was you said you did 18, 19, and 20, right?
Yep.
So you would set yourself up to do 3 fillings, right? So one thing I will share with you, and I've made this error, is never tell a patient how many fillings you're going to do, ever. Never tell them. This is what you say. Hey, Mrs. Smith, our game plan today is to start with this 1 filling on the last tooth in the back. Our game plan starts when we're done with that 1 filling, we're going to see how we both feel. And then we may move on to the next filling, or it may make sense for us to do the next filling another day. That 4 sentences will get you out of so many personal jams, because dentists are conflict averse. So they'll rush and try to do more because they said they were going to do more. When meanwhile, you wouldn't want that done on you. And what you did is totally normal. I've done it. I've bit off more than I can chew, because real life full contact arts and crafts is not predictable from both the dentist and the patient. If you do not tell people you're going to do 3 crowns, do not tell people you're going to do 4 implants, do not tell them you're going to do 3 fillings. Say, we're going to start with this project here, see how it goes, see how we both feel. When it's done, we're going to decide what to do next. And if you say those 4 sentences, you'll save yourself some aggravation later.
Thank you for the advice. Totally. You know, and something that, to add to that, what I've been and in dental school, I tried all these different things. I was on Dental Nachos. I was listening and I was watching the words, the sentences that were given out by Paul, right, and other people on there, like, hey, if I have a patient in this situation, I say this. And I tried all of them, right? Because you're in school, right? This is the best place to try it. And for me, what I found too is anthropomorphizing the tooth or the gums, right? I've noticed that you do this too. Paul's like, hey, you know what? That tooth just isn't working with me, right? Acting like the tooth is a thing, right? It's like, and usually now it's me and the patient together working against this darn tooth.
I love that. Awesome.
Yeah. And that's been great for me. So lastly, just no excuses. You know, if I'm going to be honest, right, a gripe that I had and what I noticed, especially with a lot of dentists that are coming out this time, a lot of them are my age, right? The millennial generation. I've noticed that there's a generational switch between the millennial generation and the, I would say, medium age dentist now generation, right? Social media has completely changed everything. And I think on our generation, again, talking about money, talking about compensation, right? It's like, if you have something that there could be done, you should always be looking to do more things. If you're going to collect a cent from wherever you work, like, you should be working. And just because you don't have a patient doesn't mean that you're not doing something. If I don't have a patient, my schedule falls apart. I come to the front office. Hey, what can we do? Hey, who are those patients that bailed because they got COVID? Like, how are they doing? Have we checked up on them? Like, when can we get them in? I know Mrs. Jones has that crown that we've been needing to do. She hasn't been able to because of XYZ. How can we get them in? Never, never, ever look for an excuse, and always, always, always take responsibility for things that you can take responsibility for. If you want to be a good associate, if you want your doctor to, or whoever you're working for, to like you, you should always be looking at me. What did I do wrong? And then when it comes to their office, you want our office to win. I don't care if there's a patient. I mean, think about it. I work in here at Dr. Bogle's office. He's been killing it for 25 years. His patients love him. Whatever he says that they need, they're usually like, yeah, I trust him. He does great. He sees my whole family. And guess what? Sometimes people see me and they're like, wow, you look 12. I don't think I want you to be my dentist. That doesn't hurt my feelings. Because guess what? As long as Dr. Bogle, as long as the production's made in our office, right, and we are still okay, great. However I facilitate that, great. I'll just introduce myself and things like that. So I think, again, being accepting to feedback, understanding your actual value, and then helping wherever you can, I think that goes such a long way. And yeah, that's the last thing. And of course, I think Paul's gonna love this one. JBN, seriously, JBN, just be nice. We have the coolest profession in the world. If what you want to do on your weekends is sit on dental nachos and just act like every dentist other than yourself sucks and you're amazing, like, get a hobby, right? Like there are good people out here that are really putting out great information. I hope you know it too. If you're out there and you're killing it, right? Like, Paul, I saw an implant case that you showed and I was just like, oh my God, I need to see that, right? Because sometimes I get my butt kicked on an 18 occlusal and then I look at something like that and it's like, okay, I can do better. I can do more. And yeah, I guess my gratitude really goes to everyone that's willing to share. Really, just know that the tips that I've got from that have now led to literal hundreds of patients' fillings.
I mean, I love exams. This slide. It's so important. It's also me kindly knowing people like you to pay it forward to whoever you can pay it forward to. Sometimes that's a fourth-year dental student. Sometimes that's a pre-dent. I mean, what people need to realize also, was this your last slide, Jordan? Because I want you to.
This is the last one.
Yeah, bring your own face back up big so we can see each other big here. Oh, awesome.
Absolutely.
So good.
Well, thank you.
I want to talk to you for a few more minutes, but if someone was listening,
sure.
and said, I need to reach out to Jordan right now, what's the best way for them to reach out to you, get in contact?
Yeah, Facebook, Jordan Barnett. You can reach me on Instagram. What is it? At Dr. Jordan Barnett. At Dr. Jordan Barnett. And then actually, if we can share this, Paul, I have no problem sharing this PowerPoint presentation. It has the link to my website, so you can reach me on that. And has all my contact information.
Facebook. If anybody liked the PowerPoint presentation, which was just phenomenal from this, text Jordan to 215-543-6454. Text Jordan to this number. This one's for our show later, but text the word Jordan and we'll know what to send. That's awesome. So I want to talk to you for a few minutes. That was just, I'm so grateful that you took the time to do that. That's going to help so many people, because here's one of the things that I'll share. I love creating this Nacho universe and doing my part and learning as much as I can. But we take stories the best from people who are close to us in the situation that we're in. So I have a 6 and a 2-year-old. So if someone came into my home and said, I want to give you advice on how to raise a 6 and a 2-year-old, I'd never let them look at a phone. I say, no problem. I appreciate your input. How old are your kids? They're 36. They don't get to give me the advice in the same way. Gratitude, humility, what Rich Maddow said, all that. But I'm saying this for me. I don't relate to a third-year dental student with what I do every day. I create a world. So that's why I follow people like you, a little bit ahead of you and a little bit. Then, of course, follow people down the road. I mean, Mark Costas, who I admire so much, when he didn't have a patient as an associate, he went and hung out with the office manager and kindly annoyed her to explain how insurance worked. He owns 9 practices and the Dental Success Network. So when he was in Jordan's shoes and he didn't have a patient, he didn't say, I'm not going to make any money, blah, blah. I said, how can I use this time to learn something that I couldn't even pay to get to learn? So it's such a great point that you put there. You've done so much awesome stuff here. I want to ask just a couple questions.
Yeah.
If someone said, I saw this and I want to find a job now, I'm a D4 graduating in 2021, year ago. Okay. What's the first thing you would tell them to do? Like actionable You'd say, just what's one thing? I'm a big fan of what's one thing. You've shared so many things, but they're going to graduate June of 21. What's the first thing you would tell them to do?
Yeah, I would tell them well, first find out where you want to live, right? Because, you have to have, if you're just shot out of a cannon, you have no direction, you're not going to land anywhere that you want to be, right? So find out where you want to be. Once you find that out, right, start looking at Google Fresno Madera Dental Society and start looking at classified ads. Look at who's there. Look at Craigslist. Look at these things. Start calling those laboratories and the specialists like I talked about.
Such good advice.
That's
if you're good enough for our people, because just do those things, because do that and see how it goes. See what relationships you develop, and what you had said along the way. Just be kind to everyone along the way. You never know. Somebody who call up, I recommend you just call up practices and don't be like, hey, I'm Jordan, I want a job. That's weird. Do this. Hey, my name's Dr. Jordan Barnett. I'm gonna be finishing dental school. I would love to watch this. Find out what dentistry is like in that area, and if it's a good place to raise a family. Why? Most people who answer phones are women. Men, I'd like to talk about families too. And they'll say, oh, that's it. I would love to chat with your dentist on FaceTime, take him or her out to lunch. You'd be amazed at how people want that stuff to happen. You're not asking for the date on the first call. You're just asking to find out more. So I love that advice there. Second thing.
Actually, Jordan, to that point, Paul, I want to share something real quick to that. Is the other place I work, Christopher Schaumlian's office, right? I was doing that. I was in, tell me if this sounds familiar to you, if you're a dental student. I was stuck in radiology rotation, and I was done with all of my rotation. I was done with all my requirements. Everyone else on my rotation wasn't. And I basically couldn't see a patient. I was just sat there stuck. And I was like, okay, great. This is when I'm gonna start. I was a second year. Again, UOP is 1 year less. So I wasn't even in my third year yet. I just started scrolling through. I started calling people who had jobs and said, hey, I'm nowhere near that yet. I just want to let you know that I'm interested in the area. And sure enough, that's how I met Christopher Schaumlian. I met him in my second year of dental school.
Starting to find a job starts day one, D1. Listen to my words carefully, though. Starting to find one, not starting to apply, starting to find one. And that's developing relationships, because that one magical relationship that you make. Super Dentist Boost is coming up. To get the best tickets, you can text Boost to 215-543-6454. He hates attention, so I'm going to give him even more attention. Dr. Todd Fleischmann, one of the most amazing dentists, amazing people that I know, went to study clubs when he was Jordan's age. He was the youngest guy there. He said, I'm going there to learn. When a dentist needed to sell his $1 million plus fee-for-service practice, the leader of that study club introduced that dentist to Todd, and Todd now has a fee-for-service practice that does well over $1 million a year. And he said, I got lucky, but he didn't. He had great timing, and he put himself in those scenarios. So
amen.
Do early. You can make one relationship from D3, Jordan, where you wind up buying a practice in 5 years. You don't know where life takes you. And it makes it more fun along the way anyway. So I appreciate you being such a great Nacho. We're going to take us off Facebook Live. We'll chat for a few minutes. Nacho audience, that was just pure Nacho gold that you delivered. I'm so appreciative of you sharing it, Jordan. Thanks so much.
Perfect. And then, you know what, before we take us off live, sure. I just want to say again, too, anyone watching, any student out there, it's like, I know what you're going through. Believe me, I graduated in COVID too. I know it's hard. I know it's scary. If you're being honest, you're terrified right now. And I get it, but these are things that you can do. Again, just being the best you can be, right? Being humble, approaching people and always thinking, what can I do better, right? And look, I know school's expensive. I went to UOP, so that's a pretty penny, but I can tell you right now that I got a lot out of that school, and it's been worth every penny so far. And I appreciate everyone at UOP. I have great friends there. Arias, I know he's watching. He's a huge Nachoer. So.
Awesome. Thanks.
Hi, Aria. Good seeing you. And thank you for everyone at UOP. Thank you, Paul. And good luck to all you guys. Feel free to reach out to me.
Awesome. We're going to get this shared multiple times, edited and shares. Thanks so much, Jordan.
Of course.